What brought you to Chicago?
Probably like 16 years ago, I came with my late husband. He was a pediatric surgeon, and we joined faculty at the University of Chicago and have never looked back.
You said you were a nose and throat surgeon for children. Can you tell me a little bit about that?
Yeah, so actually I focus on the ear. I am what is called a pediatric cochlear implant surgeon. So I place these little devices called cochlear implants in children who are born deaf or who have gone deaf. And this device allows them to hear, to talk, and ultimately to meld into this world educationally and socially.
Tell me how you got from that part of your profession to what you are doing now.
So many people would say, why is a surgeon doing this type of work? And actually, when you sort of hear my story, it makes a whole lot of sense. As I mentioned, I'm a cochlear implant surgeon, and I started implanting kids probably about 10 or 11 years ago here at the University of Chicago. I started their pediatric implant program and started implanting all these wonderful little kids who all appeared to have the same potentials to learn how to talk and learn. And I soon noticed after starting to implant them just these huge differences in outcomes, where some would be learning how to talk and learn just like every other child, and others would barely be able to communicate. And in trying to figure out why this was, started down this incredible path of understanding that while the cochlear implant could bring sound to a child's brain, something else was needed. And this journey really allowed me to see the importance of the first 3 years of life, the importance of language and interaction in the developing brain, and really, most importantly, the power of parents and caregivers for developing their children's brains.
Tell me what you did with this knowledge that you were gaining from watching these kids you had implanted.
Initially, it was purely, really a clinical question for me, like, here I was doing the same surgery and having these huge differences in outcomes. What could I do to really help all my kids achieve their potentials? So initially, I learned. I went back to school, if you will, while still being a surgeon, of course, and learned the science. And understanding this science of children's brain development and collaborating with tremendous experts in the field, I initially started a program for children with hearing loss, primarily from low-income backgrounds, called Project Aspire. And this program worked one-on-one with families so that they could understand the brain science, understand the science of how they could help their children after surgery. And as I was working on Project Aspire, I realized, oh my gosh, what's going on in my hearing loss population really just mirrors what's going on in the typically developing population at large. And that is truly how 30 Million Words started. So as I mentioned, the science which really helped me to see the importance of language and interaction in the first 3 years of life was done by researchers Betty Hart and Todd Risley. And their study demonstrated that by the end of the age of 3, children too often in poverty will have heard 30 million fewer words than their more affluent peers. But what's really important to emphasize, that I emphasize over and over again, was that quantity was only a really small part of the equation. I mean, it sounds like a huge word, a huge number, but really quantity was only part of the story, with quality playing a huge part, where with children hearing less number of words, also hearing less quality, less verbal interaction, many more prohibitions and less affirmations, don't do that, sit down, and less verbal back and forth. These differences in quantity and quality, I soon found, really underscored not just differences in children's vocabulary development, but really was the beginning of what we call the achievement gap, and help predict, differences in test scores and IQs in the 3rd grade.
Tell me how you got to the 30 Million Word project. I understand the research on the word gap.
Yes.
Then where did you go from there?
I always joke, because I'm a surgeon, I'm always about, well, what can we do about it? How do you take this powerful science and put it into action? And what's so key about all of this science is, even though we focus on the children, it's all about the kids, absolutely. Really, it's all about the power of parents and how you can empower them with this incredible science and the strategies to put it into action. And the way we did it at 30 Million Words was really to take this idea of a population level approach. While we care about the individual parent and child, absolutely, really what we're talking about is a shift in a population, you know, moving the needle, if you will. And towards that end, I realized, okay, we need to meet parents where they are. And it's not going to be, there are no silver bullets, it's not one single intervention. It's how do you meet parents where they are, where they go in the first 3 years of their children's lives. And towards that end, we started developing interventions or programs that meet parents in the perinatal period, on the maternity ward, in the pediatrician's office, in their homes, in their community centers, in their faith-based organizations, and developing evidence-based, scientifically rigorous programs that help parents understand the science and to turn it into action.
We like to give those tips, those takeaways.
Yes.
Are there some that are pretty much universal?
Absolutely. So there are two important aspects to all of our programs that every parent should know. One is less a strategy. It's understanding that babies' brains aren't born, they're built. That when you see your newborn little baby, really it's, you know, the brain is underdeveloped and it's absolutely dependent on your language and interaction for building it. So it's not about sending your child to school to learn. You, from day one, have the ability to build your child's brain. So that's number one, fundamental. And then how do you put that into action? We've created something that we like to call the 3 T's for building your child's brain. What are the 3 T's? Tune in, talk more, and take turns. Tuning in is first following your child's lead, seeing what your child's interested. Talk more is just as it sounds, talking more, using rich vocabulary, talking about everything in your child's surrounding. And then take turns. Take turns is viewing your child as a conversational partner from day one, even before they have words. And so if you use these 3 T's, tune in, talk more, take turns, in everything that you do, whether you're changing your baby's diaper, taking the bus downtown, or, you know, putting away the dishes, you can build your child's brain.
Could you give me some examples? Is it a constant narrative? Is it explaining things in children's world?
Yes, so really it is, we have a little saying that we like to use, explain to grow your child's brain. So instead of, you know, just putting your child's shoe on or putting on your baby's diaper, explain to grow your baby's brain. And we, in our different videos, and hopefully you'll be able to get snapshots, you can see parents explaining as they tie their baby's shoes. Oh, now we're putting your little foot into the blue shoe. Now we're tying the laces so that you won't trip and fall. And that sort of constant narrative is not just about building your baby's vocabulary or telling him what to do. It's really building his brain.
What are some of the next steps after you began to develop the information and the narrative for parents?
Yeah, so it's very exciting. As I mentioned, we have programs that work with mothers and fathers right the day after a baby's born on the maternity ward while their baby is getting their hearing test. We hope that 98% of all babies are getting their hearing tested at birth. We hope at the same time that mothers and fathers learn about the importance of their talk and interaction. We have a program going into the pediatrician's offices, as I mentioned, that while their baby is getting their 1, 2, 4, and 6 month well baby checkup, they're also learning about how their language can build their children's brain. And while all of our programs have been tested, you know, in these rigorous studies, really our next step is getting them out into the world. Our next step is a community proof point where we partner with a community across the United States and implement it so that, you know, all parents can understand this powerful, important message.
Can you tell me a little bit about the studies?
Each of our different programs is different in terms of dosage. So the newborn intervention is the lightest dose. It's basically a 10-minute video while the baby is getting the hearing test. And we have worked with, probably now in the thousands of parents, testing this out. And what we found that even on day one, and listen, I'm a mom who's had 3 kids, I was like, how are moms going to remember this? But we've found that just on day one, seeing this video, that they, number one, we increased their knowledge significantly, where they understand that their language, even from day one, is building their children's brain. And so knowledge is obviously a really important first step. So all of our programs have been able to demonstrate significant impacts on parent knowledge. Because what we found is, even though, now I know this important science, not everybody does, and that's a first step. So we've been able to show impacts on knowledge. How about behaviors? We've found some really exciting impacts on behavior. So our higher dosage program, which is our home visiting program, where we go into the home and work with parents one-on-one over 6 months, we've shown really important impacts on how parents interact with their kids. Not only are they using more words and having more conversations, that's a given, but they're actually having more math talk. So we always think about language just as talk, but really there are lots of different talks. So we've been able to show impacts on math and spatial talk, because how much math and spatial talk, like, that's a big triangle, or look at the number of Cheerios you have, predicts children's math ability when they start school. So we've shown impacts on that. We've shown impacts on how parents read with their children. So really exciting impacts on knowledge and behavior of parents. But what about kids? Certainly we're still following kids long term, because it takes a while for kids to grow, but we've shown impacts on children's vocabulary, even from lighter touch interventions such as our pediatric intervention. We've shown impacts on their vocabulary and their math and spatial talk.
The 30 million word project, how would you describe it? Is it a nonprofit?
Yes. What is the 30 Million Word Initiative? It's actually a translational research program at the University of Chicago, where we develop evidence-based programs that work with parents and caregivers during the first 3 years of their children's life. So many people think we're on-the-ground not-for-profit, but really we're the researchers building these programs that hopefully everybody will use.
I know you're based here in Chicago, but has this been implemented anywhere besides the city?
Yeah, so we have a partnership down in Pensacola, and we're in talks with many different cities across the country, and actually across the world, trying to figure out, our next steps for who we partner with.
When did you begin? How long has this been in existence now?
It's probably been since 2009, I think.
Tell me a little bit about your background. Where did you get your undergraduate and your master's?
I actually went to a 6-year medical program right out of high school, because I knew I wanted to be a doctor, and I went to the University of Missouri in Kansas City, and then I did my residency in Pennsylvania, actually at the University of Pennsylvania, and went off to fellowship at WashU in St. Louis, where I became a cochlear implant surgeon for children.